All right, welcome back for the final video in this series of videos from the seminar, Optimize Your Potential, 5 Keys to Achieving Your Best Level of Health Possible. In this video, we're going to be covering structure, the structure of the body. And you may be thinking to yourself, well, what does that mean and how does that affect my health actually? Well, what I'm actually referring to is the skeletal system of the body, which would be like the framework of the body, okay? It's what holds everything together. But really, the reason we're so interested in the structure of the body and making sure that it stays healthy isn't so much because of that. It's actually because of what the structure houses, and that's your nervous system, which is what provides all of the electrical energy that runs the entire body. Now, let me explain how that works first, and then we're going to go into what the structure is and how we work with that, okay? All right, so your nervous system is composed of 3 different things here. You've got your brain, which looks like this. Well, it looks like that kind of. I'm not a very good artist, so you're going to have to forgive me for that. I'm just a chiropractor. All right, so number 1, we have our brain. The second part of the nervous system is the spinal cord here. And then off of the spinal cord comes all the spinal nerves. And these nerves travel out into all the different parts of the body. And what they're responsible for doing is for sending electricity from the brain down through the spinal cord, out through the nerves, to the body parts so that everything can function and work like it's supposed to. Okay? This is really equivalent to how the electricity runs in your home. If you think about it, the electricity comes from the outside from the power lines. So that would be what your brain is doing here. That's the source of the power, is the brain. And then that electricity comes into the home and through the breaker box. The breaker box would be just like your spinal cord. And then from there, the electricity is transmitted through all the different electrical wires that go into your house. And that's how you have power that runs the house, correct? So it's the exact same thing that happens inside of your body. Now, your brain is so important that it's actually surrounded by bone, and we call that the skull, okay? And the spinal cord is also so important that it's also surrounded by bone to protect it. However, it's different because it's actually surrounded by a number of individual bones that are separated from each other. We call these vertebrae. And of course, the reason that happens and the reason it's so important that these bones stay separated is because that's what allows our bodies to move. You see, we can bend, we can twist, we can pick things up, we can do all kinds of things, all because those bones are separated, and that's what allows movement to happen, and that's what allows us to work the way that our bodies work. Now, if we take a closer look at this, I brought this model here for you. Hopefully you can see this clearly in the video. But notice how I've got the bones stacked on top of each other. In between the bones is a disc, which is like a cushion, okay, that separates the bones. And then if you look a little closer at the back, you're going to notice that there's an opening that's created there, and that's where the nerves are leaving the spine, and they're going out and they're communicating with your body or sending energy to the body so that the body can function properly. Now, this is where the problem actually comes in. Because of our activity level, sports that we play, slips and falls that we have, whatever it is that we're doing, and by the way, the opposite can be true too. If you're sitting too long during the day, like we talked about earlier in one of these videos, what can happen is that over time, these vertebrae can start to shift out of their normal alignment. And when they shift out of the normal alignment, notice what happens. Do you see how as that bone moves backwards, it starts to put pressure on that nerve there? Now, they've done studies, and what they have found is that it doesn't take much pressure on a nerve for it to stop working the way that it's supposed to. And in fact, what they have found is that if you look at this nickel here, if I take this nickel and I place it right on top of my hand there, the little bit of pressure that I feel from that nickel laying on my hand is enough to cause a nerve to stop working by 65%. Now, what that means is that whatever that nerve is going to isn't getting 65% of the energy that it needs for it to function. So let me give you a good example here. Let's say that we're talking about the nerve that goes to your heart and provides electricity to your heart so your heart can function like it's supposed to. Do you really want only 35% of the energy going to the heart that's supposed to get there? Absolutely not. You want 100%, right? I mean, it's kind of a dumb question if you think about it. You want 100% of the energy coming from your brain out to the heart so that the heart can function at its best as much as possible, okay? And that's the real key here. So as a chiropractor, what my job is I find out where those misalignments are in your spine. We correct the misalignment and realign the vertebrae where they're supposed to be. The pressure comes off the nerve, and then all of a sudden the nerve flow starts to happen at 100% again, and then whatever that nerve is going to starts to work at its best also. Okay, that's the bottom line. It's a lot like, going back to the analogy of the electricity in your house. What happens when a breaker switch goes out? Okay, when the breaker switch goes out, it cuts off all electricity to whatever electrical line that's going to, correct? So what we've got to do is we've got to find out which breaker switch is turned off. We've got to flip it back on, and now the electricity goes back into the house and works like it's supposed to. Okay, everything turns back on. It all works the way that it should. And that's what we're doing. We're basically finding out where your breaker switches have been turned off, flipping the switch, turning it all back on so that everything works like it's supposed to. Okay. Now, what's interesting too about the nervous system is that 90% of the nerves go to things that you're designed not to feel. You actually only feel 10% of your body, if you can believe that. And it actually makes sense when you think about it. Okay, so for example, I don't want to feel my heart beating in my chest. I don't want to feel food digesting through my digestive tract. I don't want to feel blood pumping through my blood vessels. All right, that you're not supposed to feel that. If you do feel that, it's already to a point where there's a problem there. Okay, so your body is designed so that 90% of the things that your nerves are going to, you actually can't feel. And this comes up a lot in our practice because we have two different types of patients that come to see us. One type comes in because they're in pain and they're looking for some kind of relief. Another type of patient comes in because they feel perfectly healthy, but they're wanting to utilize chiropractic in order to make sure that they maintain their health and that their nervous systems function at its optimum so that their bodies can function at its optimum. Okay? And people ask, well, why would you do that? Why would you go see the chiropractor if you're feeling perfectly fine? And the truth of the matter is they do that because you can't feel 90% of your body. It has nothing to do with how you feel. You could have a subluxation developing or a misalignment where it's putting pressure on those nerves and stopping the nerve from functioning, and you wouldn't even know it because it's going to something that you're designed not to feel. And this is why people come in to see us even when they're pain-free, because we want to make sure that we keep the body functioning at 100%. Okay? And by the way, this isn't a foreign concept. A lot of people say, well, that's not true. If something goes wrong, I should be able to feel it, right? Well, no, there's a lot of things that happen to people that they can't feel until it's too late. For example, a heart attack. Did you ever hear that, and this is actually just the way it is, the number one symptom of a heart attack is actually death. And what that means is the majority of people who have a heart attack never had a single symptom to warn them that something was wrong with their heart. But we know that heart attack didn't just happen, right? It didn't happen just today that my arteries just completely got blocked and I have no blood flow going to my heart anymore, so my heart dies, right? That didn't just happen today. That took years and years and years for those arteries to get clogged up and to stop working the way that they're supposed to until eventually I had the final problem, which was the heart attack. Same thing with cancer. This is why so many people die of cancer, because a lot of times it's not caught early enough. Most people don't have a single symptom until the cancer is at one of the very end stages, and it's a major problem. But you'd say, well, wouldn't I have a symptom? No, it's not the way that the body works. You see, your body is designed to adapt as much as possible. It will deal with the problem as much as it possibly can until it becomes so major that all of a sudden it has to tell you, hey, something isn't right here, all right? The same thing happens with the cavity. If I have a cavity in my tooth, that cavity didn't just come all of a sudden. It takes months and months for the cavity to dig down into the tooth until it eventually hits the nerve, and all of a sudden you feel pain in your tooth, right? But the cavity was developing for a long time before the symptom actually came about. And that's why we go to our dentist to get our teeth checked regularly, right? We want to make sure they stay healthy so we avoid all of that problem if we can. Same thing with the hip that's deteriorated. When you have arthritis in the hip, typically you're not going to feel it developing until it becomes bone on bone. But let me tell you, when it gets bone on bone, you're going to feel that hip pain. It's going to be nasty for you. So you have to realize that this is how the body works. A lot of problems develop long before we actually feel them. And so it's really important that you have these types of problems evaluated for early before you feel the symptom to make sure that it's not developing. And if it is, get it corrected early so that your body can function at its optimum. That's what we're talking about here. Now, another question that comes up is, well, if I want 100% of the nerve energy passing and controlling to my body to be at 100% at all times, well, how long do I want that for? Do I want it just for today, or do I want it for the rest of my life? And the answer is I want it for as long as I can get it, right? And that's another reason that people come to see us regularly, even if they're feeling okay, because we want to make sure that we keep that nerve flow at 100% at all times, if at all possible. I see my chiropractor every single week. Whether I feel bad or not, it's just something that's a part of my normal health routine, because I know that I feel differently and better, and that my body functions better when I keep my nervous system working at 100%. And that's all that we're talking about here with structure. All right, that's all we have to say for this class. I hope you enjoyed it, and I hope you got a lot out of it for today. I appreciate you spending your time with us, and we'll see you on another video hopefully sometime soon.